Hello, I'm Edith Martin, and I was matron from 1947 until 1963. My first duties included preparing for the introduction of the NHS the following year, and then guiding the hospital through these changes. This brought many changes, not least the fact that medical care was now free at the point of contact. This made a huge difference to health and welfare of the nation, and meant we could offer care to everyone without them worrying about how they would pay for treatment. Following the foundation of the NHS, the hospital joined the Charing Cross Group, which brought about important changes to nurse training. This meant we were able to take student nurses off clinical duties for blocks of 2 to 6 weeks, so they could attend lectures and concentrate on their studies. I was particularly passionate about ensuring the quality of nurse training and the welfare of the nursing staff at the hospital. My greatest legacy was the establishment of a recreation hall which provided social facilities for nurses away from the hospital. The Edith Martin Hall was opened by Mr. Sidney Walton in October 1963. Like Miss Peake, I was fortunate to meet many visitors to the hospital, including the King of Norway, who presented prizes at the nurses' graduation ceremony in the 50s. During this period, the role of the hospital superintendent was abolished, and my role was extended to being responsible for the whole hospital, not just the nursing staff. Of course, the 1950s were overshadowed by the Willesden train disaster in October 1952, when 3 trains collided. Tragically, 112 people died and over 300 were injured. Once news reached the hospital, we made as much space as possible in readiness to receive casualties. 4 of those casualties required surgery at the hospital for traumatic injuries such as fractures and dislocations. The more serious injuries were treated at the larger hospitals, including Edgware. It was an honour to have worked at Harrow Cottage Hospital.